So a lot of people over 50 are just told, you're old and you're aging, so that's probably why, your joints are hurting and things. But from a neurological and regenerative standpoint, why is that often not the case?
First of all, I mean, when we're, as neurologists too as well, we hear other doctors tell other patients, well, hey, you're not really remembering things, you're just getting older. Or the patients say, I have old timers or something like that, right?
Hmm.
But the fact of the matter is that there are a lot of people who are actually still living who are much significantly older, who have minimal joint aches and pains and all of that. And so while everybody does eventually get some level of arthritis as, things break down a little bit and instability starts creeping in, it depends on how well we take care of ourselves. So a lot of that can be nutritional and environmental factors too as well, which often is just simply not addressed at all, usually in most doctor visits. And so there are opportunities for people to actually improve simply by just changing their diet and then also implementing exercise too as well. I think one of the things that often gets missed as people start aging is that we actually lose muscle for every decade of life. We need to be increasing more protein essentially to help keep the muscle, but then we also need to do exercise to help maintain the muscle and develop muscle. And if we don't do that, as I mentioned before about the knee, we just create more instability in those areas that are already starting to get damaged. And so those are the things that we kind of really need to address. And for those people who are taking care of themselves, they tend to see less of that as opposed to the people who are simply not taking care of themselves.